Yeah. So now we are going to deal with first disease condition, which is thrombophlebitis. So as we have said yesterday, we are having a remaining some sort of topics. So in that first one is thrombophlebitis. So thrombophlebitis is a condition that causes a blood clot to form and block one of the veins, usually often of the legs or your hand also. See, the superficial thrombophlebitis as well as we have deep thrombophlebitis. So, superficial thrombophlebitis can be happen when you do a cannulation, as well as the deep thrombophlebitis can cause DVT, deep vein thrombosis. Okay, so that is thrombophlebitis. So, it can be a clot in anywhere in the vein. Okay. Now, what are the symptoms? See, I identify like this. If if the circulation is impaired by the clot, which means you are having a normal blood vessel, so in that normal blood vessel there is a clot. What happens? First thing, the circulation, the blood to that portion will be impaired. There will be a delay in the blood supply. So see, it doesn't say that it have completely cut off the blood supply, but since there is a presence of a clot, there is a decreased circulation to that area. There will be decreased oxygen supply to that area. Yeah. So when there is a when there is a decreased circulation, we may have right. Redness or swelling at that area. Warmth will be there. Tenderness will be there. Pain in that affecting the area will be there. So these are the main things which you can see in the superficial thrombophlebitis. And in case of deep vein thrombosis, DVT also, you can have a pain as well as you can have a swelling right at that area. So those are the main differences. Now, see, what are the causes? The main causes of these thrombophlebitis are any injury to the vein. So that's we have said. So when we are doing a IV cannulation, which it itself is an injury to the vein, and a clot may be happened. Okay. Then if the patient who are having inherited blood disorders, the patients who are having the diseases like clotting, diseases like which is affecting the clot formation. Then a person who is been really immobilized for a longer period of time, like a long bone fracture. That's why we are saying that a long bone fracture is a classical example or classical indication for deep vein thrombosis. Or if patient is bedridden for other conditions like coma, or if the patient is on ventilator, if the patient had an major surgeries, hip transplantation. So all these major conditions, major diseases which makes the patient immobilized in bed. So those conditions may leads to these thrombus formation. Okay. And the main risk factors are this one: the prolonged period of inactiveness. Then any varicosities may leads to this. Then a person with pacemakers, okay, or thin catheter tubes inside the central veins. Then what? Yeah, definitely write this down. Birth control pills. Okay, or a hormonal replacement therapy. A person with birth control pills or hormonal replacement therapy. So these patients are also very vulnerable to develop the thrombophlebitis. And stroke, obviously stroke, atrial fibrillation, whereas the heart will be contracting in a non-rhythmic manner, which increases the chance of stroke. Overweight, obesity, and the person who smokes. Okay, so the clot which is formed due to the smoking is due to the nicotine. The clot will be having a nicotine in itself. There will be nicotine in its presence. Then cancer, again, a cancer will cause will delay the uh, bleeding as well as the clotting time. Okay, that is what's about the thrombophlebitis. See, if when we are dealing with deep vein thrombosis, the sign which you have to check is Homan sign. So when you extend the leg, you will be having pain in the calf muscle. Okay, that is Homan sign. Okay, kindly note, in case of DVT, you will be having Homan sign. The Homan sign will be positive in case of DVT. Okay. Now, what are the complications that may occur? The main complication that may occur is that there will be the clot. The clot can dislodge to any part of the body. Okay. See, there is a deep vein thrombosis in the veins. There are thrombus. I have already said that what is the difference between thrombus and emboli, right? So thrombus is an attached clot, whereas embolism is a floating clot. So, when there is a larger thrombus, there is a high risk of this thrombus converting into an emboli. So, the main complication is the blood clot may dislodge from the particular area, and it can move to any part of the body, which may cause the complications. As first one is the clot may be present in the lungs, which is precipitated as pulmonary embolism. Okay, so that is dislodgement of the this clot from the vein may leads to pulmonary embolism. Then post-phlebitic syndromes. Okay, then what? Yeah, again, this emboli may be dislodged and it may go into your brain, cerebral trans ischemic attack, or called as a mini stroke. It can happen like that, or any ischemic stroke can happen. Okay, so those are the complications of this thrombophlebitis. Now, how will you diagnose it? See, if it is a superficial phlebitis, you can see that the area will be having. See, in the first stage, in this first stage of phlebitis, when there is a decreased oxygen supply to this area, you can have the warmth, you can feel the redness, you can feel the edema. When this condition persists, what happens? When there is a decreased oxygen supply, what happens? The area will be cool and clammy, right? That is later stages. See, initial stage there will be redness, warmth in that area. Okay, see, this same thing can happen in cellulitis also. Okay, there will be warmth in that particular area, right, due to occlusion in any of the veins or the arteries, usually in the veins. Okay, so uh, the, that is the first indication that you have to check into. Then, if you are seeing the warmth of that area, redness of that area, edema of that area, which the edema should not be encouraged with any other sort of cardiovascular diseases, right? So the patient's other parameters should be normal, and then only you have to check for the edema of the leg, which is associated with a deep vein thrombosis or not. So what is the confirmatory management? We'll just do the ultrasound of that leg. So color Doppler or an ultrasound of the leg will indicate that whether there is any occlusion in the veins of the leg or not. Okay. So then we'll do the blood test. We'll do the blood test for D-dimerizine. Okay. Then if these conditions are not prevailing, or if you are not getting a proper explanation for on these um, scan, you will go for CT as well as MRI of the entire area. Okay. So this is how the thrombophlebitis is considered. And the what is the management of thrombophlebitis? We'll keep the patient on heparin. Okay, anoxaparin or simple heparin will do. It is also a lysing, blood lysing mechanism will be given. Okay, so that's the simple management of thrombophlebitis. Or if it is a larger clot, we'll go for embolectomy. Clear? Any doubt on thrombophlebitis? Next condition is varicose vein. So, what do you mean by varicose vein? See, uh, see, what is a varicose vein? Usually, where's my pen? Usually, what happens is that suppose this is your v- this is your normal vein. Okay, this is your normal vein, and this is a abnormal vein. See, the veins are having valves. Okay, the veins are having valves like this. Okay, so what is the function of these valves? See, in each heartbeat, the blood which is present in this area, usually in the leg. Okay, varicose veins are usually seen in the legs. See, a blood in this area will be moved to this area. Okay, in one heartbeat. Okay, and this blood, the blood which is present in here, is prevented from falling back by these valve. Okay, this valve will close. Again, in the next heartbeat, the blood in this area will move to the next area. Again, this valve will close. Okay, then what do you mean by varicose vein? The problem is with this valve. So any valvular problem, the valves of the vein, it loses its elasticity. Thus, the valves won't be able to accommodate the fluid or the blood which is in capacity. And thus, when the valves are damaged, the blood which is present in this will be pulled towards the lower area. That is called varicose vein. Clear what is varicose vein is. Okay, so it can be said, it can be seen as a bulging or an enlarged vein. Okay, on your, suppose this is your leg, you can see you can see the veins which can be peripheral veins will be engorged, and also you can see kinking of the veins. See, the veins will be kinked like this. You can usually see the veins like this. That is the varicose vein. What is the reason? It is due to the loosening the elasticity of the what? The valves in the veins. Okay. So what are the symptoms? Again, while seeing itself, you can identify the varicose vein. There will be dark purple or blue colored vessels will be easily seen. There will be a bulge, often look like a cord on the legs. And what are the what are the symptoms that is associated with veins? You can have heavy feeling in the legs. There will be aching leg, then burning, throbbing, muscle cramp will be the, then swelling will be the pain. Usually worsens after sitting or standing for a longer time. Itching will be there. Okay, kindly note, in the varicose vein you can feel itching over there, and there is a skin changes, skin color changes will be there. Okay, so that is varicose vein. Now, what are the causes? We have said what is varicose vein. Now, what are the causes? The main causes, the problem with the damage in the valves. Okay, the damage in the valves leads to varicosity. Right. Then, if the muscles are not enough tight to pump the muscles for prolonged standing, like the varicose veins are a main problem with the securities, and even the theater nurses may have the two disease conditions the theater nurses are having is IVDP as well as varicose vein. Okay, and next thing, the complications of varicosity. You can form an ulcer. Okay, varicose ulcer will be the blood clots may be formed, bleeding can be seen in varicose vein. Okay, and leg swelling will be this swelling is usually the common complication of the varicose vein. And how will you prevent it? See, nothing. You have to do the what is the main cause of the varicose vein? The prolonged standing, right? So you have to cut short the standing, and you have to wear the what you should not wear any high heels. Okay, then compression this stockings will help. Eating a high fiber, low salt diet will also help. Exercise properly. Exercising the calf muscles will help the pumping of the blood towards the heart. So that's about the varicosities. And what is the surgery? But before that, how will you diagnose this? It's simply by looking into the leg. We can understand whether there is varicosities or not. Okay. For the confirmatory test, we'll do the ultrasound. And what is the management treatment? Compression stoking is the first thing. Then second one is surgery. Okay. In the surgery, which are the surgeries that will we do? So first surgery is sclerotherapy. Sclerotherapy. First thing is sclerotherapy. So what is done in sclerotherapy? See, the doctor injects the varicose vein with a solution that scars and closes them. That is sclerotherapy. A solution is injected to the vein to form a scar, and the scar will close itself by that. The second one is a laser therapy, laser treatment. What? A strong burst of light is introduced onto the varicose vein. Thus, the vein slowly fades. Okay, there is no cutting or kneading. That is laser treatment. Then there is traditionally in the government hospital, still the surgery is known as a Trendelenburg surgery. Trendelenburg surgery. See, what is Trendelenburg position? Trendelenburg position is, suppose this is a normal position, keeping the patient in this area. Head will be like this, body will be like this. Is Trendelenburg position. Okay. What is the need for the Trendelenburg position? In order to enhance the flow of blood towards the head in case of what hypotension, right? So, and if there is vasa previa, if there is an kinging of the lower abdomen, so if you want to drain the lower part to the to the upper portion, we'll go with the Trundle procedure. And the Trundle surgery is completely having no relation with the Trundle procedure position. Okay, Trendelenburg surgery is a different surgery where you will do stripping and ligation of the veins. Okay, see, suppose this is your vein, suppose this is your leg, and this is a vein. An opening will be made here, and then a catheter will be passed through here, and the catheter will be taken from this side, making a king opening at this position, thus completely stripping out the vein. Okay. See, you may have a doubt that what happens if the complete vein is destroyed. See, the veins in the body are having a peculiar feature that there will be uh, they'll they'll get another circulation at that area. Okay, that is stripping and ligation. That is Trendelenburg surgery. Then we can go for phlebectomy also. Okay, so that's about the varicose vein. The next condition is your peripheral artery diseases. Peripheral artery diseases. So peripheral arteries means your hand as well as your like arms, legs are the usually areas which is affected by these peripheral artery diseases. What happened? See again, the blood vessel is occluded. So when there is a circulation problem, peripheral vascular diseases or peripheral artery diseases. See, under peripheral artery disease, under peripheral vascular diseases, we have peripheral artery diseases as well as peripheral venous diseases. But just don't go into such kind of deeper things. Just understand peripheral vascular diseases. See, it includes both arteries as well as a vein. Okay. So when there is a circulatory problem, what happens? The skin will be cold. Okay. Usually it is affecting the lower foods. Then you can have numbness as well as weakness of that area. Pulse in the feet. See, suppose this here in this artery there is a problem. Then you won't be feel a dorsalis pedis artery here. Okay. So, in the peripheral vascular diseases, the artery which you have to check is this dorsalis pedis artery, because the extreme arteries will help you to understand the problem. What is the usual problems? Okay, then there will be, as I have said, there won't be any pulse, or a pulse will be weaker on the legs if it is affected with PVD. Then shiny skins on the legs. Okay, skin color changes, then slower growth nails. No growth nail. Sorry, the toenails will grow slower because of decreased oxygen supply. Okay. Then erectile dysfunction will be there in case of uh, a PVD. Then hair loss. Why so? Because the circulation is impaired. When the circulation is impaired, the nails as well as the hair will come brittle and they may fall apart. Okay. And what are the main causes of these PVDs? The PVD may be caused by blood vessel inflammations, any injury to the arms or the legs, any muscle tear or the problems, then radiation exposures. Okay, so these things can cause, and the main complicating areas it will leads to limb ischemia. So when there is ischemia, that particular area we have to amputate. Yeah. Stroke or a heart attack can happen because the occlusion can be in that what your in your coronary arteries also. The peripheral usually the peripheral arteries will be having this clot, but this clot can be dislodged into any portion. Okay. Kindly note this: if it is a clot forming disease, okay, if it is a clot forming disease, then this clot forming disease will be affecting the any part of the body. Okay, it may dislodge to any part of the body. Then how will you prevent it? Sugar, you have to control the sugar, you have to control the pressure, the blood pressure. Then you have to control the obesity, weight have to be maintained. Smoking, you should not smoke. See, the smoking will leads to a disease condition which is known as in our syllabus we have to check into two disease conditions. First one is thromboangiitis obliterans, okay, which is otherwise known as Buer's disease. Okay, Buer's disease. Kindly note this: these things are asked in multiple time. Thromboangiitis obliterans and Raynaud's syndrome, Raynaud's disease or Raynaud's syndrome disease. Okay. See, the thromboangiitis obliterans or Buer's diseases, both are due to smoking. Okay, smoking is the main reason for thromboangiitis obliterans as well as the Raynaud's disease. So what happens in Raynaud's disease is that due to smoking, the nicotine will be deposited in the arteries. Okay, so which may cause a larger areas of involvement. Okay, but what a Raynaud's disease is that it will the nicotine will be usually deposited in the digitals, the arteries which are supplying your hand, the fingers, the arteries which are supplying your finger. Here you can see the deposition of the nicotine. Okay, so the nicotine will be deposited in the arteries of the fingers. That's why the Raynaud's disease is known. It can be classified as spasm of the digital arteries, spasm of your digital arteries. This is the main difference. This is the main difference between Buer's disease and Raynaud's disease. In Buer's disease, it can be on your hands, it can be in the radial artery, it can be in the ulnar artery. Okay, anywhere there can be Buer's disease. But the Raynaud's disease is the deposition of these nicotine in the digital arteries, which causes spasm of the digital artery. Okay. Now, the signs, the symptoms, the complications are no as same as that of peripheral vascular diseases. At that particular area, you will be having spasm, you will be having pain, the sensation will be lost. Usually, in case of Raynaud's syndrome, the sensation will be impaired. The first initially there will be redness followed by cool and clammy skin. Okay. So, if it is a clot, you know that is a clot, right? So, what is the management of the clot? So, medical management is we'll thrombolize, surgical management is we'll do the embolectomy. Okay, so that's about the peripheral vascular diseases. Now, we have to move into the aneurysm. See the term aneurysm. We have we have the aneurysm as well as veneurism. Veneurism, veneurism means it is a dilation of the veins, whereas aneurysm is dilation of the arteries. Okay. Now, suppose this is a normal artery. Okay. What is an aneurysm is? It can be like this. This is aneurysm. Okay. It is a bulge or ballooning in the blood vessels. That is aneurysm. Clear? It is an enlargement in the blood vessel. Now, see, there are some types of aneurysms. Okay, we have saccular aneurysm, then fusiform aneurysm, myotonic aneurysm. But I haven't seen any question in the prometric which is specifying the types of aneurysm, or there is such thing known as a pseudo aneurysm also. But no questions have been ever asked in that diseases. So that's why I am leaving that. Okay. Now, aneurysm can be differentiated on where it is located. If it is in the brain, suppose the if the cerebral artery is having an aneurysm, okay, if your cerebral artery is having an aneurysm like this, then we'll call it as a cerebral aneurysm. Okay, if it is your aorta, if the aorta is in the thoracic area, if the thoracic area is having an aneurysm, we'll call it as thoracic aortic aneurysm. If it is in the abdominal area, we'll call it as abdominal aortic aneurysm, AAA. So these are the classifications of aneurysm. It depends upon which area is involved. That is known as an aneurysm. Yeah. Usually the aneurysm doesn't show. If it is small, usually doesn't show any sort of complications. It will be the okay. The main complication with the aneurysm is that there is a high chance of rupture when the aneurysm ruptures, since it is an artery, right? When an artery ruptures, the patient dies. The patient dies due to bleeding. If the artery is involved, the patient may die due to bleeding. That is a main complication of aneurysm, ruptured aneurysm. This cerebral aneurysm, okay, the cerebral aneurysm comes under ICSO, intracranial space occupying lesion. Okay, so when the cerebral aneurysm ruptures, what happens? The patient may have a sudden headache with no explanation. There will be blurring of vision. There will be nausea, vomiting, stiff neck. The patient will be sensitive to light. There will be seizures. Then loss of confusion, loss of consciousness, and confusions will be there. Okay, so these are the signs of ruptured aneurysm in case of cerebral aneurysm. Okay, there will be nausea, there will be neck stiffness, then double vision or blurred vision, seizures will be there. Then what? Sensitivity to light. Again, your eyelids will be drooping. You will be having a drooping eyelid and loss of consciousness, and there will be confusion. It will be a state of condition. This is the complications of ruptured aneurysm. Right. Then second one, there is a leaking aneurysm. So what happens in a leaking aneurysm? See, this is an aneurysm, and if there is a small opening in that aneurysm, that is known as a leaking aneurysm. Rupture means this wall will entirely will be broken off. So leaking aneurysm, again, in case of leaking aneurysm, all the complications which we have said will be having, but that will be having on a lower pace. Okay, we'll have a time for that to understand that. Clear. So that's about the aneurysms and what is the main causes. See, the main cause of aneurysm is thinning of the arterial walls. The arterial wall will be thin. Now, the causes, the older age may cause these aneurysm, right? See, then cigarette smoking, high blood pressure, then use of cocaine. Kindly note that the cocaine have a high intensive action on the aneurysm. Cocaine will raise the blood pressure and thus affecting the thin, which will affect the walls to be make the walls to be thin. Then what? Ehlers-Danlos syndrome again. The connective tissue disorder, Ehlers-Danlos syndrome. It will cause the aneurysm. Kindly write it down. Ehlers-Danlos syndrome. Then polycystic kidney diseases. Then what? Coarctation of your aorta. What is coarctation of aorta? This is the normal aorta, right? So what is coarctation? There will be a dip in the aorta. This is known as the coarctation of aorta. See, this is coarctation of aorta. Then arteriovenous malformations in the brain. Okay, when it is tangled, and any family history of aneurysm, all these things can cause an aneurysm. Okay, then how will you treat it? See, usually there is no medical treatment. How will you diagnose this? MRI will do. Okay, an MRI will suggest that there is an aneurysm or not. Then cerebral angiogram will do to understand the involvement of the arteries. Then we'll go with the surgery. Surgical clipping. For the aneurysm, we'll go with the surgical clipping. See, this is aneurysm, and we'll just clip the aneurysm. Okay, it is like that. We won't do anything. We'll just clip the aneurysm like this, so that if the walls rupture, there won't be any leaking. Okay, that is surgical clipping. Then other standing, you can also apply stents, coils are all the things which we have doing. Okay, then symptomatic management, other symptomatic managements will be done. Okay, that's about the aneurysm. Now, other what is remaining now? Do you want me to explain any other disease condition? So I think we have completed a majority of the disease condition which is affecting your cardiovascular system. Now, one thing is that shock. Remaining thing is the shock. Okay, it is an emergency room management. See, shock. There will be a cardiogenic shock, a hypovolemic shock, hypervolemic shock, then anaphylactic shock. Okay, so cardiogenic shock means heart is involved. CPCR. This is the management for the cardiovascular shock. Anaphylactic shock. Again, if anaphylactic shock will leads to cardiovascular shock, which again comes to the CPCR, and I will as well as the hydrocortisone management. Then hypovolemic shock, decreased fluid. So you have to increase the fluid. That is the management. Hypervolemic shock, there is a condition which leads to increased fluid. Lasix is the management. Okay. So there are some stages of shocks. Like initially, it depends upon what shock it is. Okay, so if it is a life-threatening thing, there will be narrowing of the blood vessels, hands as well as feet. Feet. So multiple organ can be damaged. So first, your focus should be on your what your heart. Circulation of the heart have to be kept ready, as well as you have to check for your breath, your respiration. So once you stabilize the heart as well as your respiration, the others can be managed. Okay, and special care to have to be given to the brain also. The brain should not be deprived of oxygen as well as the glucose for more than 5 minutes. Okay, and there's a high this hypoglycemic shock also. Hypoglycemic shock, when the sugar level is less, it may leads to a shock. And again, within 5 minutes, if you are not giving glucose to the patient, there will be irreversible tissue damage to the brain. Okay, so that's about the shock, and thus we have cleared the classes. We have completed the entire cardiovascular system. So, guys, are you having any doubt in this?